Hi, everybody. Good morning. Okay, so we're gonna um, start where we left off. So Doreen had remaining unanswered questions, so I'm gonna pull those up. And she's the MVP from the last session because she followed up with an email with like more questions and stuff. And Shrija, I said your name right, did I? You're the MVP from the previous one because you had the most participation and you also scribed the session without even being asked, because afterwards I was like, oh, we didn't have a scribe, but we did. We had a secret scribe. So if you guys can just say something so I can make sure that I can hear you, okay?
Can you hear this?
Yeah.
Can you hear
All
me?
right. So it's just me and Shrija, I guess, because I didn't hear
Hello.
anyone else.
Hi. Hello.
Okay, very good.
Hi.
Okay.
Hey.
Okay. Yeah. Okay, now I see a bunch of people. This is good. Okay, so let me see if I can find Doreen's questions. The most rewarding part of medical school. Okay. Oh, that's a happy and good and exciting one. There was a lot of rewarding stuff in medical school, actually. First of all, getting into medical school was like, wow, that's I was pretty happy about that. So, I don't even want to be cliche, but it's like you help a lot of people and a lot of patients and like a lot of underserved people. Um, One really cute that stands out to me is a little girl when I worked at Children's National Hospital wrote me a letter about how I helped her baby sister's heart. And I was like, oh my goodness. And I still have it and I saved it and it's so precious. But patients all the time, I have a board at work, like a little, you can stick a pin in it, hang up all kinds of art and stuff of like my patients' letters and pictures that they've drawn, and obviously like that's pretty rewarding and that stuff sticks out to me. I had a patient like do a sketch of me. So a lot of times when you are working in healthcare, I'm sure you guys hear a lot about like burnout, and the ones of you that are writing the meta-analysis of sort of about burnout and COVID and stuff probably are exposed to a lot of the negatives. Like, I mean, I could have you write an entire book about a patient punched me in the stomach once, a patient threw his bedside urinal at me and got pee all over me. I had a patient pull out their colostomy bag and throw their feces on me. So like, you hear about all these like really negative things. And you get really frustrated when you're working in healthcare and you do all this to help other people and they just throw poop at you. But alternatively, there's lots of positives, like people drawing you pictures and thanking you and writing you letters and that sort of thing. But I also think about the people that do the really awful stuff is like they're really scared. I mean, some of them are just jerks. Let's put that like, okay, some of them are just jerks. But a lot of the people they're just really scared. They're nervous, they're angry, maybe their insurance just denied something, or maybe they're about to die. Like, it's not terribly representative of how they would typically act. So I think a lot of times people do leave and they're like, whoa, like I was really rude to that doctor or really mean to that nurse, so you just have to suppress some of the mean things that patients do. But definitely rewarding is when they draw pictures and send letters and thank you and that sort of thing. And then graduation was really rewarding. It was like, look at me, I'm a doctor, all my hard work paid off. Now, question number 2, what is the best way to ensure that you are in the best position to ace the interview portion of medical school? So I spoke a little bit last time about how people are good in different areas. And I mean, I'm sure there's very few people that are excel in absolutely everything. And well, kind of when you do get to medical school, everybody kind of had to excel in everything and to get there. But I have just personally noticed a correlation with the people that have photographic memories that get 100% on all their multiple choice tests are not the same people that have really good social skills, or like their interview skills might be terrible, but they got like a perfect score on the MCAT, right? So the best way to ensure that you're in the best position to ace the interview, regardless of how approachable you are, like throughout my whole life, if there was a superlative, like senior superlatives, like I got most outgoing, right? And I was elected social chair, like undefeated every single year. So like, I wasn't terribly worried about the interview. And also whenever I speak to people, I don't worry, oh, like this may be more in a social situation. If they don't like me, then they can just not call me and ask me to hang out again, right? Like there's plenty of people, and if they didn't like me, why would I want to hang out with them? And the same thing kind of goes for and if the school doesn't like you, do you want to go there? Like I've had interviewers ask like really inappropriate questions, and I'm like, I guess if you get a little bit desperate when you're applying to medical school, it changes a little bit for residency. You could be a little bit more picky. But if they ask a question like, oh, are you planning to get pregnant in medical school? I'll be like, it sounds like you're not going to be super supportive, so I might not want to go here. But to do a good job during your interview, you should practice the questions ahead of time. So there's no way to really know what they're going to ask. But you can kind of go online and figure it out. You can, my computer is like making, there we go. You can ask people like, what kind of questions do they ask? There's like the very standard questions that, why are you going? Oh, actually, the next question is the best way to tackle the why medicine question. That's funny because I was just going to say. So the really run-of-the-mill stuff, you can practice that ahead of time. Now, there are some of the places, and these are the places that I like the best, are going to ask like off the wall. Like I got something like, if you were a superhero, what would your theme song be? Like you need to be able to think on the spot for like the really far out wild questions. But what I did is I would have, I don't know if you guys are familiar with what a clinical vignette is. I would keep some cases that I had in my past that really stood out to me, like let's say 6 or so. And I would have like a good example of, all right, here's a patient that was really difficult. Here's a patient that there was some sort of ethics situation with the hospital going on. Here's a time where I didn't perform as well as I should. Here's a time where I did. So I had like 6 examples of different patient-related patient care scenarios that kind of reflected different situations, so that if during the interview they were like, oh, what was a time where you felt like you didn't perform your best? I'd be like, that's my patient example number 2. Now, I wouldn't tell them that I memorized that, but I would have something really quick to reference instead of going in without any examples. And then when they ask you, you have to sit there and go, and then like wait and go through like every one of the 1,000 patients that you've seen in your life until you think of the one that makes the most sense. So I would say have 6 examples sort of like at the tip of your tongue ready to go, but not like the same 6 type of situations. You need one that represents all sorts of different situations. Yeah, I mean, they really love like the ethical questions. I was telling Miriam the other day, and I was just say, well, this is going to go on YouTube. I don't know if this guy's going to watch this, but this was like, this was like, I want to say 20 years ago. Does that make sense? Anyway, it was a long time ago. And I was shadowing this geriatrician. He was doing rounds in the hospital. And I had looked at the patient notes, and we were going to amputate this lady's foot the next day. And we went into her room and she was like, "Are you gonna amputate my foot?" He's like, "No, no, we're not." And I was like, okay. And then I left and I was like, why'd you lie to that lady? So mad at me. He's like, "It's the only way she would have slept tonight. If we would have told her that we were amputating her foot tomorrow, she would have never got any sleep." And I'm just like, okay. And you know what? Still to this day, I'm not really sure about that, but that was a great one that I used as like my ethical kind of dilemma. So they're gonna want stuff like that. They don't want somebody coming into their school that's never had to face any sort of controversy. And sometimes these things don't really have a right answer. Like like you would poll an audience of like 100 doctors and like 50 of them would say this and the other 50 would say the other thing. So you need examples of difficult situations to bring up during your interview, because most medical school interviews do ask you about challenging moral or ethical dilemmas. So I don't know if they still do this. Some of the medical schools do these like weird psychological things where like when I was like put in a room with a phone that rang, and I don't know if they were watching me to see if I had answered the phone, but I'm just sitting there and this phone's ringing and it's ringing and I'm like looking around, I'm like, whoa, like am I supposed to answer this? I don't know. Are you watching me? Maybe you don't want to go to a medical school that's gonna do something like that. I had another medical school that was like, you have to find the interview room, but we're like not going to tell you how to get there. Oh, and by the way, you have to be there in 10 minutes. And if you're late, then you fail your interview. And I had to like go through like a locker room and a janitor's closet, and somebody needs to mute their mic. And so I'm going through and I'm like, oh my gosh, I have 10 minutes. So I guess that was like a stressed interview. Maybe you don't want to go to a school that's going to do that, or maybe you like that kind of thing. But the best way to ace the interview is to practice multiple scenarios and have a lot of things at the tip of your tongue that you're ready to say. Okay, the best way to tackle the why medicine question. I did not look at these. I know that Doreen emailed them to me 2 days ago, but I'm looking at them for the first time right now. Wow, the best way to tackle. I don't know. I guess the other day we talked about it wasn't so much the case back when I interviewed, but now it's like, why are you applying to medical school versus PA school versus nursing school versus occupational therapy versus podiatry school? I didn't really get that many, and I would be afraid to answer that now, especially like this is gonna go up on YouTube, but I don't know. Typically, at least back in my day, it was the physician that kind of led everything. And why would you just said like I want to practice I like as much as I can, like, and get as much information as I can and have the most education. And I'm kind of a gunner, like whatever the top level, that's what I want to go for. I want to do as much as I humanly can. I mean, but now I don't really know like what other like what nurse practitioners, like I don't know how to answer. They will probably ask you during your medical school interviews, like, why do you want to be a doctor, not a nurse practitioner? Why do you want to be a doctor, not a physician assistant? Which I do think physician assistants are now called physician associates. So you got to be up on these like terms, because back in my day, I didn't really know what a nurse practitioner was until my OBGYN rotation, like my 3rd year of medical school. So obviously they weren't asking me why I didn't want to be one, because I didn't even know that was a thing until like my 3rd year of medical school, right? But now the times are changing and there's so many different options. So maybe I'll ask you guys, why do you guys want to go to medical school and not PA school? Or do you? I don't know. I didn't make it a requirement to want to have to go to medical school. Do any of you want to do podiatry or occupational therapy, or what do you guys tell me?
I want to go to medical school primarily because of my family's history with genetics and like cancers. So I want to be able to help treat people directly. when they're dealing with cancer diagnosis and stuff like that.
But couldn't you do that as a physician's assistant or nurse practitioner?
I feel like when you're a doctor, you have primary control over a certain person's
See,
case.
that's what I thought too, but I don't know if that's the case, or I don't know if I get in trouble. Cause then I don't want anybody being like, oh my goodness, didn't you know that the PAs have the primary control? Well, I mean, the physician associates, I don't know. You guys have to educate me on this. So whenever you go, and I actually was supposed to go to my oncologist and I went there and it was a PA. So I don't see, you guys gotta get into it. So let's pretend that I'm interviewing you. So why don't you want to be an oncologic PA? And yeah, answer that. Huh? That's tough. Or like the other way around, like what if you wanted to be a PA and they're like, why don't you want to go to medical school? This, you guys got to write this down because this is going to require more investigation. Like, what do people say? Not only it's like, no matter what it is that you're going for, you don't want to insult the other specialties or other occupations that you're not going for. So it could be like tricky to answer that question. Like, you don't want to say like, I don't want to do that occupation because I don't want to have to study that much. I don't know, like you might want to be honest, but you also can't be offensive. So does anybody have a good answer to these? And if not, I think that would make a great next assignment for you guys to really figure out the differences and figure out like what people like, why people would say, um, like let's say
One,
you
I've
want to
heard,
be an ophthalmologist, which requires you to go to medical school and like you're interviewing for medical, not that you need to know your specialty when you're interviewing for medical school, but let's just say you're getting interviewed and they're like, okay, why do you want to go to medical school? You're like, I want to be an ophthalmologist. And they're like, whoa, well, why don't you just go to optometry school? And then what are you going to say? Huh? Yeah. So, okay. Anybody have any good comebacks or anything that's going to be
I hope this is right, but I've heard that only doctors can do surgery, and I know that like PAs and NPs can't do as much as doctors can in terms of like having like a surgery. Like we have like surgery like intern year and like residency and stuff, but I don't know. I don't think PAs and NPs have that. So because I know that
well?
PAs have like
That's
a
what I thought too, but I keep
yeah.
seeing that like they're getting more and more levels of approval to do like I think I saw somewhere that like an NP did a colonoscopy. I don't want to say the wrong thing. And also because like when I'm reading these things, they're on doctor forums, so they're probably biased from a doctor's standpoint. They're probably like, oh, like only doctors should I don't know. So this is a good thing to research because when you're getting interviewed, I bet they're gonna ask you, but I can't tell you from my experience because they didn't ask that stuff back when I interviewed. Oh, back when I interviewed 1,000 years ago, nurse practitioners didn't exist. No, I don't know. I'm not that old, guys, but I'm just saying that these are questions that you're gonna have to deal with now that are new. And so like the why medicine, or maybe when I think why medicine, I think like why medical school, because typically like there's different ways to think of medicine. So let's go through this. There's the physical pills that are in a bottle, that's medicine, right? And then there's medicine as in the practice of medicine. So when you graduate from medical school, you get a medical degree and a license to practice medicine. But when you graduate from NP school, I do believe that it's from the Board of Nursing. So they don't have a quote license to practice medicine. So there's the pill of medicine, there's the practice of medicine, and then there's also medicine, the specialty, which can be really confusing to people. So like you may hear whenever people are talking about different specialties, you may hear them say, okay, like neurology, rheumatology, neurosurgery, medicine, pediatrics, and you may think medicine, like that's a specialty, but yes, it's internal medicine, and those are the internists, and they're the hospitalists. And can you hold on for 1 second? My child is So medicine is a specialty in itself, and it's confusing. This is like, you guys are like gonna be way beyond everybody, because I remember it was like, what, medicine? But no, there's medicine, the pills, medicine, the practice of, which all the doctors do. There's medicine, the specialty, which is its own residency, right? And so when with the question about why medicine, that could mean a lot of different things. But to me, I read it like, why are you going into medical school? And then let's see, let me look, where did these questions go? I X'd out of them. Oh, and then you gotta be you gotta be careful with the cliche answers. Like, I like science and I want to help people. Well, that's probably true for everybody, right? And the thing about the interviews is that you want to stand out. And so it's hard, because like that's could very well be your answer, but it's like, you don't want to sound like every single other person that just came in. So definitely practice what you want to say. So I'm a little bit quirky, in case you guys haven't noticed. Well, especially in the morning when I have energy, but now that I have kids, I get up at like 5 a.m. And so if you do meet with me at like 7, I'm not quite like this, because I'm going to go to sleep at 8:30 p.m. But you want to find something about you that's going to stand out, similar to how I explained to you guys how to get letters of recommendation. Is that you have to stand out because your professors have 200 students, and I stood out by basically hanging out in their office all the time. They all knew who I was. You want to make sure that they can differentiate you from all the other students. And so it's the same thing with your interviews. Like, they're drained, they've been talking to applicants all day, and like some of them start blending together, and you want to be different, but you don't want to be different in a bad way. You don't want to go in like a clown costume and be like, I stand out. They're gonna be like, yeah, you stand out as a reject. I remember this was at a residency interview. I was 4 psychiatry residents, and I must admit, a lot of the psych residents and psychiatrists I know are just different and interesting people. But this guy was clipping his toenails in the waiting room. So that is a way to stand out. However, I don't think that they were going to offer him the position, because he was clipping his toenails in the waiting room, waiting to get let in for his interview. So you want to stand out, but not in a negative way. What is the exam schedule like in medical school? Well, it depends on what medical school you go to. The one that I went to, I liked the fact that they would integrate clinical rotation starting first year. I can't see Rachel. Is Rachel on? She's in medical school, but she said that there are no clinicals until 2nd and 3rd year. So a lot of medical schools are set up, the first 2 years are kind of just like college, and you're going over anatomy and physiology and biochem, pharmacology. And then the second 2 years, you go into the hospital, you start working on your rotations. Every month you switch into a different specialty. Where I went to medical school, it was mostly like that, but they had something called a CAP, which is like a clinical preceptor that you would work with at a regular interval, like in an office. So I worked in the United States Coast Guard headquarters as like a medic, doing like physical exams on like some of the pilots and different things. So I got to start doing clinical stuff early, and I kind of like that, because it gives you a longer, like 4-year exposure rather than just the 2-year. But still, most of what I was doing was exams. So the first 2 years, they're going to be like classes, and I think there's like a block schedule. So some medical schools will do the whole year, like 5 classes a day. Some of them will be like, the first half we're going to do these 3 classes, and the second half we're going to do these other 2 classes. It really depends on where you go. But usually our exams were on Fridays, which was great for my social chairing, because once you finish your exams on Fridays, that's probably the only time that you're going to allow yourself a break from studying. So Friday nights, I would always rent out like these clubs in DC and get bottle service. Man, I'm not, we had a good old recreational time on Friday nights. But if it was like a Thursday, it just happened to work out really well. But then you start studying like the next day, right? Because there's no time to waste when it comes to studying. So I suppose that usually it depends on the professor too. Maybe some professors like to torture people and make the exams like in the middle of the week. But in general, they would be on Fridays. Now, when you do your clinical rotations, you would have exams still. And it's not like you're in a class and they're teaching you and you have an exam. It's like you are in your pediatrics rotation and then you take what is called the pediatrics shelf exam, which doesn't have anything to do with shelves or bookshelves or any sort of thing you'd buy at IKEA. It was just the shelf exam, and they weren't teaching you for it. So you just had to kind of know everything there was to know about pediatrics. You would buy like, you just go online and buy like a shelf exam or like case file books or do as much. Oh, Sheree did point out, I hope somebody's taking notes. Yeah, you guys have to decide amongst yourselves who's going to be the scribe for every session. That's not my job. Shreecha, MVP twice. This is like, Samira, there's some competition. Okay, well, we'll see whose notes are better. No, I'm just kidding. You guys keep scribing. Okay, so we're talking about like shelves and studying. So it's kind of hard to really know what's going to be on the shelf exam. It's just very generally, okay, it's the pediatric shelf exam or it's a surgery shelf exam. So those are the kind of exams that you would have during your clinical years. And it is really difficult because some of your attendings don't care if you have a test coming up. Some of them you could be like, I have my shelf exam tomorrow. Would it be okay if I had some time today to study? And they'd be cool attendings like me. And they'd be like, okay, that seems reasonable. But then some of them have this mentality, which is kind of what improved medical culture is trying to fix, is that, I suffered heinously in medical school, so I'm going to make you suffer as well. So if you say, hey, attending, I have a shelf exam tomorrow, would it be okay if I had some time off to study? They may reply, oh, you have a shelf exam? Okay, well, I'm not letting you out here until midnight, sorry. And so you got to find your own time to study. It just depends on what your attendings. And when I say attendings, let's be real. Looking back, like medical students may not have really had much interaction with attendings at all. It's usually the residents you're asking permission from. Like, I feel like these attendings are these like glowing beings that medical students are like terrified of. So usually you would ask your resident, like, hey, is it okay? Because I don't know. I hope the culture has changed, but it was kind of scary for medical students to talk to attendings. You'd have to have the medical student ask the residents or ask the attending what to do. But I don't know. Hopefully that's changed because we're all human beings. None of us are actually glowing with a godlike aura, right? So some of your attendings will be approachable, down to earth, and some of them will be like, I can't believe this peon is talking to me right now. So you're just gonna have to gauge the situation based on your surroundings at the time. But if you're like me, you'll find time to study in the shower, on the bus, every time I sat down for dinner, you better believe that I would have a lecture playing in my headphones at 2 times speed. You gotta study as much as you can. Oh, extracurricular activities that I can participate in that would set me apart from the other medical students while applying. Okay, right. So whenever you are applying to medical school, I'm going to assume I don't know the stats on this, but in general, like most people would be like a pre-med major or biology major or something. But I know people that were like Spanish majors, but the thing is if you're gonna do a non-pre-med major or non-bio major, you also have to do a pre-med major and a bio major, if you know what I mean. Like, for example, let's say your major is Spanish, you still have to take all the OChem and all the physics and all the chemistry and all that stuff to get into medical school. So you will end up being a bio or a pre-med major, even if you're actually a Spanish major. So I was a psychology major, but I still had to do all the other stuff. So I ended up taking so many classes that I graduated an entire year early. I just crammed them all in. I had like 24 credits a semester. I don't know. I was a wild studier. So you can look different by having like a different major. And you want to see what your school, your top schools are looking for. And some of them may not care what your major was, just so long as you did all the required classwork. But for the extracurriculars, I mean, I just did so much stuff. I think it would be really cool if you would have a public, I know, like, it's really hard, but if you had a publication going in, I think that would stand out. Yeah, I used to really like to write. Like, I'd write like 40-page articles. It was wild. So I think having a publication, and then something that just is like not they're gonna see every day. Like, they're gonna see a lot of like, I shadowed a primary care doctor, you know. But if you're like, I shadowed the county medical examiner and we solved murders, like, that might be something a little different. So maybe like a specialty that they're not gonna hear about every day. Like, it's something, well, it's going to be hard because if they are that rare, they're going to be so busy, they're probably not going to respond to your emails. But that's where networking comes in. And that's something that I love to do, to go to events and make friends with people that know other people. And so, like, I recommended just kind of Googling and like searching for people's emails and emailing them. Like, that's a good strategy, but they may just ignore you if they don't know who you are. But if it's like, hello, dear Dr. whoever, Dr. such and such, your friend from your fraternity in college said that I should contact you, then they might be like, oh, you know him? Well, he's a cool guy. I'll talk to you too. So make lots of friends, and then you can get into shadow like different specialties. I'm not saying don't shadow a primary care doctor. I'm just saying that it's probably like a requirement that everybody's going to shadow a primary care doctor, right? And then let's see, you know, they like you to have interests outside of medicine. So I do mixed martial arts and marathon running, but I actually didn't start doing that until residency. Well, I've been a long distance runner for like 20 years, but I didn't start such long distances marathons until residency. I would do like 10 milers and stuff, but the whole 26.2 thing hasn't been the case whenever like I was applying. But I would tell them, you know, I had lots of like sporty hobbies, and I did like to run. And it's hard to think like, what were my hobbies back then? Because they're actually different now. I do different things. Like right now, I'm like really into like true crime kind of stuff. And that's not something that I was into back whenever I was applying to medical school. But I have always been like a huge sci-fi fan. So you want to have something outside of medicine to talk about too. So make sure that you, like, I don't know, like maybe you go horseback riding, or maybe you volunteer at an animal shelter, or maybe you crochet, that sort of thing, art. So just participate in activities that you enjoy, because it's going to be a lot of your time. And if you're doing something that's making you miserable, that's probably not going to be the greatest tactic. So what kind of activities do you guys have that are unrelated to medicine? And each one of you is going to share one. Unless you don't have anything and only medicine is the only thing you're interested in which case we need to find you a hobby.
A hobby or like an
I do debating.
extracurricular?
And like, I don't know, you play softball or you paint figurines.
I can start. I've been doing art since I was like 6. So
Okay, so now if you're at an interview and you're like, I do art, you gotta say
be more
like,
specific, yeah.
what mediums do you use? Do you use charcoal? Do you use acrylic? Oil painting? Do you sculpt? Like, you can't just say art.
Yeah,
You
yeah,
gotta
yeah.
get specific.
I was just
So
about to
let's-
go into that. So I definitely like experiment with different medias, but right now I've been doing lots of oil painting and acrylic painting. And I've been trying to get more into portraiture.
Okay, see, that's what I'm looking for. All right, who's going next?
I'll go next.
I play basketball
Uh,
and I've weightlifted for a couple years now.
Okay, so how much can you bench?
I have no idea. I don't
How
use the
much do you
barbell.
squat?
Like 2 plates, 2.5 plates,
And how much does the bar weigh?
45 pounds.
Okay, see, okay, so here's an example. If you say you do something, you can't lie because they're gonna be like, what if they know about it? So like, I did write that I spoke a little Japanese and it wasn't a lie. I never said I was fluent, but I was prepared for like, if they were like, okay, what is like some basic things that you could say? And then I had some stuff prepared. So like, let's say that you say you lift weights and they're like, how much does the bar weigh? And you don't know, they're gonna know that you don't lift weights. You see what I mean? But you said 45 pounds. So we all know Marcus can lift weights. We know that he's telling the truth. And basketball. Okay, good. Now, who else? And be careful because if I know about it, then I might ask you follow-up questions. And if you don't know the answer, you could embarrass yourself. So be prepared to have follow-up questions about anything you say.
Can you hear me?
Yes.
Oh, okay. I do debate and speech.
Okay. All right. So for debate, are you ever allowed to, what's it called? Like, not like relinquish or like agree with the other side or say that they are right about a point or say that you're wrong about a point?
I mean, we can say we can't like agree to them, right? Because like, I mean, that defeats the whole purpose. I mean, like,
Okay, I think debate is so interesting, and I think I've told a few of you that like that's something that I would like to get into more. I don't know, like one class about how to debate, and the only thing I remember about it is that they told us to never say that the other side, like, you shouldn't go up and be like, yeah, we were wrong about this, and the other side, because in real life debate, when you're talking to someone, it may be a good idea to admit like when you're wrong. But I think informal debate, when you're on the debate team, you're not supposed to do that. Is that correct? I mean, I only took one class and who knows if they told me the right information.
yeah, even if they're like factually accurate, you still have to attack them. Like you can't, yeah.
Okay, so I think the debate thing is an interesting extracurricular, and it sounds like you know what you're talking about. Who's next?
Sorry, you can go. Oh, okay. I'm also on the debate team. I do public forum debate, and I've been playing piano for almost 10 years.
Oh, okay. All right, so we asked about debate. What do I know about piano? I know that my 3-year-old plays the piano and she plays Chopsticks and Baby Shark. So that's I can play the Star Wars theme song on the piano. But that's really all I know. So I can't, you know, I was gonna say pimp you, and then I realized that could sound really ridiculous because I'm sure you guys don't know what pimping is. Does anybody know what pimping is? And not
I know, I actually know. I saw TikTok about it the other day. It's
okay,
when
so-
like when doctors ask like med students like questions just like randomly.
Yeah, and it's kind of malicious, and it's put in my place. And so when I meant pimping you about playing the piano, that would be kind of what I did to Marcus when he said he lifted weights, and I was like, how much does the bar weigh? It would be like asking a question in kind of a not nice way to catch somebody in a lie or to show that they're not as smart, or they don't know what they're talking about, like that sort of thing. So there's like a Socratic round type of thing, which I like, in that I like to ask people follow-up questions because it helps them retain the knowledge, but I don't like the whole like, oh, well, I'm gonna ask you this to make you look dumb or make me look super smart. Like that's more of a pimping thing. I'm glad you knew, because like if I just tell a random group of students that I was gonna pimp them, that might sound, I might get a few calls from people's parents. But no, it stands for put in my place, and that's a thing that for some strange reason doctors like to do with the younger group. But I won't do that to you guys. I'll be nice and ask nice questions. Who's next?
I also do debate. I do congressional debate, and I do classical dance, and I have been for like the last 10 years.
Okay, so what do I know? I don't know much about classical dance, so I can neither pimp you nor ask you follow-up questions about that. So why don't you tell me, hey, why don't you show us? Come on, do a little dance, let's see it.
Like, I mean, I could show a step possibly, like.
Yeah, let's do it. See, putting people on the spot is what these doctors during medical school are gonna love to do to you guys. So we're just gonna practice a little bit. Is it uncomfortable for Dr. Waggel to ask you to do a dance in front of everybody? Yes. Will it prepare you for what medical school is going to do? Yes. So please go ahead.
I could show like a simple hand gesture. So what we do for a lot of dances, especially for the first step, is we put our hands like this. And a lot of the hand gestures in classical dance are meant to imitate something because you're often telling stories while you're dancing. So the first step is putting your hands like this in front of your chest. And while you beat the same leg, you open one hand and then you open the other hand. And you keep doing that for a series of around 6 to 8 steps. And that's the first step of Kuchipudi.
Wow. See, I didn't know that. You educated me. You demonstrated that you know what you're talking about, and you didn't completely crumble to the ground when I asked you to do something that could be potentially awkward or embarrassing, which it wasn't. You did a great job. See, a lot of people when they're put on the spot like that is that they would like run out of the room and close the door. But I'm not doing this to torture you guys. I'm doing this to prepare you for, like I said, when you guys are out rounding, everybody's going to be listening and some attending. Oh my gosh. Again, when I tell like stories, I'm always like, oh, this is going to go on YouTube, and I feel bad if the person I'm talking about like is listening. But I was rotating. I must have been an intern, and there was an off service other intern. And off service means whatever rotation you're doing, if the people are like with another group. So this is internal medicine, and he was an anesthesia like resident, and he was just with us. So he was off service, and he said angina, which I've heard a billion people say angina, but our attending just like reamed him and was saying you have to say angina, and was like angina sounds like and like he started crying, and it's just like, oh my gosh. And I will tell you the amount of crying that was involved in medical school and residency. It was, I don't mean to scare you guys. Don't be scared. But I'm just telling you like the truth. Like there was someone was crying every day. Every day there was crying. I remember, and I could go on forever, but we were talking about lupus. We were rounding. I just said lupus. Somebody had a rash. Somebody had an immune response, and I just said something about lupus. And my attending and fellow screamed at me about how stupid of a diagnosis lupus would be, and how only a moron would say something about lupus. And I actually, at the time, had like no emotions, and the thickest skin was like, ugh, whatever. I actually started crying. And I kid you not, they continued yelling at me for 45 minutes. I cried in a public forum in front of people with my attendings yell at me for something as stupid as saying lupus for 45 minutes. So being able to put on a dance and be put on the spot and do things that are uncomfortable is really hopefully not anymore, but in my experience was kind of the name of the game in medical school, especially clinicals. And you like my friends used to text me like during certain surgery rotations, like, hey, I need to cry today. And I'm like, awesome, man. So not that you guys are all too young to ever have watched Sex and the City, but there was a specific episode about Samantha, who is like this really high profile, really well respected, high ranking career like businesswoman, and how there was one time something happened and she almost started crying at work, but she was like able to run on the elevator like before people would see her. And it's like, so my husband's an engineer, and I'm like, have you ever seen anybody cry at work? He's like, no. And I'm like, man, improved medical culture really needs to start helping, because it's like the culture, like, why would, if you see that the person you're yelling at is crying, why would you continue yelling at them for 45 minutes? So I am going to try to be real nice to you guys, but at the same time, I'm going to let you know like what may happen. Hopefully, like I keep saying, like I hope these things are going to change. But Shrija, you did a really good job of being put on the spot and doing the dance and not like freaking out. And I feel like maybe if you were rounding at Children's Hospital and you said lupus, and then they were like, you're so stupid for saying lupus, like maybe you'd be like, you would be, maybe I'm just preparing you to have to deal with these really difficult situations. And I'm also not condoning that people are put in these situations. And I'm not saying that this is appropriate and this is how it should be. I definitely don't think it should be this way, but I think that still at a lot of medical schools it still is this way. And so the more you guys know, I think right now, and the more you practice with me, receiving abuse, not that I'm going to abuse you, but I'm just going to tell you stories and things, like the more exposure, the less shocking it will become if or when it happens in the future. Does that make sense to you guys? And none of you should have to endure this, but statistically, if you're going to go to medical school, you're probably going to have to. And again, like I was saying, it's because the attendings have this mentality, like I was treated like garbage when I was a med student, so I have to treat you like garbage too. Maybe we will be the generation that finally ends that cycle, but just in case there's still a few people out there lingering like that, you guys will not be completely shocked when it happens. Okay, so man, why do these questions keep going? So were there people left? I think there were people left that didn't share their hobby. And now that we've had this whole conversation, you better make sure you know all about your hobby and you're prepared to demonstrate it. Okay, who's next?
Yeah.
I can go next.
Oh, sorry, go ahead. Yeah.
No, I love everybody volunteering at once. That's what I want to see.
So I've been playing the flute and the piccolo for about 7 years, and essentially like I've like outside of school I like to immerse myself in like other like extracurriculars. So for example, like I've like received like superior rankings for like playing at like festivals, for example, and I actually brought my flute. So this is the head joint, and this is where you place your mouth, and then I also have like the middle joint, and this is where all the keys are, and then I have the foot joint, which is where like you put like your pinky. So essentially, to put it together, you want to take the head joint and the middle joint, and you want to like slide it together like so, and you want to make sure that this hole where you put your mouth is lined up with all the other keys. And then in order to place your foot joint onto the flute, you're going to slide it into the middle joint, and then it should kind of be in the middle of this last key. And for you guys, like I can play like the like a note of F.
All right. Well, I hope that I don't have to take a test on this later, because I'm not going to remember all that. But my mom played the flute, and I always thought it was so beautiful. So thank you for sharing that with us. And again, thank you for demonstrating, because it can be difficult for people, you know, like when you go out with somebody and they're a singer and you're like, oh, like, can you sing us a song? And they're like, please no. You know, you just have to get over that hurdle. And Doreen was like, you know what? I got my flute right here and I'm going to play it. And so you got over that hurdle. And I think that's really great. And I want you guys to all get to a point where you can do things that are a little bit uncomfortable, because that's how you make your comfort bubble bigger, right? Okay. All right. Who's going to go next?
I can go next. So I've actually been dancing for like the past 13 years, and it's a dance form that's really similar to what Shrija does, but it's a different one. It's called Bharatanatyam, and I'm on my college's dance team. So we've gone to like competitions.
I saw a video. You're
yeah.
really good.
But yeah, and I love choreographing those dances. But yeah, that's my main hobby right now.
All right, just do one move, just to expand the comfort bubble.
Yeah. I guess one I could do is, let's see. Okay, so she did like one of the like more like it's like one that Shrija did is like very like basic, and it's like the first thing you learn when you learn dance.
Well, I'm glad that she started me with that, because that's where I need to start.
So I guess the next one I could do is like you say like start with this position, and then like dance is like you kind of have to make sure you're going like when you're going, your body is like going to the right, your eyes look to the left. So that's like something unique about the type of dance I do. So if like my body is like, if I'm like moving my hand this way, I look that way. And then like you bring it back down, and then if you move your hand like this way, you look that way. And it kind of like shows the audience that you're not just kind of like staring at one side, and like you're kind of occupying the whole stage.
Okay, well now I'm 2 steps in. Well, that's really cool. See, during your interviews, you're going to have something to say other than like, I like medicine, I like science. See, you're going to be interesting and stand out. And did, Riddy? Okay, good.
Sorry,
That's
not
not embarrassing if you did.
My hobby is similar to what Samira was talking about. So I've been doing acrylic painting for my entire life. And then more recently around like quarantine, I started getting into color pencil portraits. So I took that art and then I kind of expanded it into my community as well. And I started teaching lessons to like kids in the community. And then I also built a social media around my art so I could connect with artists like across the world, especially during quarantine when I didn't have contact with other people.
Okay, and so, oh, that reminds me, whoever's taking notes to make a note about social media and your guys' social media and mine for later. Because we will be happy to support you if you want, but do you have any pictures on you, or are you just gonna, what's behind you? Is that the one on the wall behind you? Did you
No, that's a picture of my sister. I have my,
you painted it. Do you have anything to show us?
yeah, I do have I have like a couple paintings up, but I also have my Instagram.
We're getting a tour of Riddy's home, everybody.
Yeah, you are. So that's one of them.
Oh my gosh, see, it could have been the picture of your sister for all I know. Oh, cool.
Yeah.
And wait, you said that was acrylic?
Yeah, those are acrylic from like a few years ago. That's like a while ago, but I have like more recent colored pencil things on my Instagram.
Okay, cool. So if you're at an interview, that's something good to talk about. That's not like, I like science. And then like, I don't know if they would ask you to like get your phone out and show, you know, I think it would be a really good session for us to have is if I could have somebody come on that has done recent medical school. I know my best friend, who's also a psychiatrist, Dr. Rosenblatt, I know he does, I don't know if he'll be, down for like doing a session with students or anything, but maybe, I don't know, I'll ask him, but he has been interviewing medical students. I can at least ask him like what kind of questions, because I can only tell you my experience, which, I mean, it was a long time ago, not that long ago. I mean, come on, I'm not that old, but I do think that a lot of the questions are going to change, but I don't know, maybe they'll be like, hey, get out your phone and show us some of your art. Because I do know that like whatever you say, you're going to need to back it up. And again, we can call that the how much does the bar weigh kind of a question, because if you're going to say like if they were like, okay, you said that you speak some Japanese, and they'd be like, say something, and I would be like, doetashi mashite, which is doitashi mashite, but they don't say the shi because it means death, and it also means for, so you have to take it out. So when you say you're welcome, you have to take it out. And so like I practiced some things and had like an example of like culture. So they might be like, oh, well, I thought it was pronounced this way. And then I could tell them, well, where I was, they took that syllable out, so I could talk about it. So it's kind of like those 6 clinical vignettes I told you about, like have something a little bit prepared to say, not memorize, because they'll be able to tell if you're like reciting the Gettysburg Address or whatever, but you know, have like points to talk about. Like I also would talk about how when I was teaching in Japan, I would say like, there's so many words that to us, and I don't think any of you guys are Japanese. So when I say us, I mean anybody who's not Japanese. It sounds the same, like kawaii and kawaii, which sound, but one means cute and one means scary. So for the longest time, I kept calling the kids scary instead of calling them cute, which is just like a funny little anecdote that would back up my claim to know a little bit of Japanese. Now, I would not claim today because I think I was there, oh my gosh, 20 years ago. No way. Hold on. A long it's in my brain somewhere, but I would not make that claim now because if somebody, well, actually, I mean, I have a little bit story still in there, but if you're going to say anything during an interview, you better be able to back it up. So let me see if that was the last of Doreen's questions. Okay, so activities like hobbies, different languages you speak, and standing out. You don't want to be like, I like science. I shadowed a primary care doctor, which there's nothing wrong with primary care doctors. I'm just saying is that probably the person who they just interviewed before you had said that. So you might all start blending together. You know, speaking of blending together, I got this like really poor feedback, like this really bad grade in this one rotation. And I'm like, this doesn't make any sense. And then I like read more and it was like talking about like the computer chart or something. And I was like, that rotation, like I only did like paper charts. And then I found out that they got me confused with another blonde girl. And I'm like, are you kidding me? So you must make sure people know who you are. And at least if they get you confused with somebody else, they get you confused with somebody that's going to get a good grade, right? So you want to stand out. That was the last question of Doreen's questions. And it's about 11, but if anybody has like something that they must know now, I would be willing to do one more question.
I have a quick question, but it's not like pre-med related. It's about the event on August 12th. How many people are you expecting to come? Just because like when we're looking for venues, some of them have like guest counts, like roughly.
So that's the thing about these events is that they ask you questions that you can't know until they sign up. You know what? Let's say 200.
Okay.
And let's aim for 200. And Miriam actually had a really good point yesterday. She was like, a lot of these people are not going to be responsive over the weekend and the assignment's due on Monday. So I think like doing it today would probably be to your benefit because trying to contact people on the weekend, probably not going to go anywhere. Yeah, so the first thing we have to do is find a place. So initially I was going to have it in the parking lot of where my office is, but I guess the people that own it had a vote and some people said yes, but I guess more people said no than yes. So like I guess it's out. But if it's for a fundraiser, like Miriam was like, oh, what if we use Ida Lee again, which is in Leesburg, and that was for a sexual assault prevention event, and that cost like $750, and then I had to get insurance. So like I like spent out of my own pocket like probably more than $1,000. And you know, maybe I don't want to do that if we don't have to, especially since it's a volunteer. It's not like I'm having a wedding, right? I could see like if it was my wedding and I needed a venue and spending $1,000, but like this is entirely going to support women with postpartum depression or pregnant women. Like we could use a parking lot, we could use a gymnasium, we can use the lobby of one of those medical buildings or like an OBGYN lobby. You know, it doesn't have to be a wedding venue for so Idly was nice, but you know, it's like a wedding hall, right? Like I feel like there's better alternatives. Or like at a park, like one of those like big where they have like the picnic tables, like what am I like, not a tent, but like just one of those wooden
A
structures.
pavilion?
Yes, thank you. The word I was looking for was pavilion. Yes, so like a pavilion, you know, it's and then tell the people like, you know, if you want to donate, maybe you could donate the area to us and we could mark you down as a contributor because, you know, it's not like I'm having a birthday party for my kids, and in which case I would have no problem paying, but it's like a charity fundraiser. So yeah, the first thing is we got to find a place because Miriam started making flyers, but it was like the location was like question mark. And I'm like, if I saw this, I would be like, I'm not going to this event because it looks like it's going to be in a speakeasy or some underground crazy. No, we need to say where the event is. And then the next thing that's due is to get the vendors, but you can't ask really the vendors if you don't know where to tell them to be. So we got to do everything in order. And it was like, yeah, we don't know how many people are going to come, but if you have to say, let's aim for 200.
And one thing, I know that Dr. Waggel, you mentioned something about an Ashburn magazine ad. So if any of you guys like interns, like one of you guys, can you like just, I'll like forward the email over to one person who just wants to like volunteer for it if anyone wants to do it. So just like text me or email me that you want to do that. Okay, I see Samira raising her hand. So if you want to do it, you can, but yeah. I don't know if we want like one person or multiple people. I think one person should be enough.
Well, we could have somebody get into ads once we get, because in the ad, people that are coming as just like guests are going to want to know what booths are going to be there. But we can't tell them what booths until we get booths.
Yeah.
We can't get booths until we have the location. You got what I'm saying?
Yeah, that makes sense. Okay, yeah, I just was wondering because you sent an email to me earlier this morning about it.
I said that because, and when it comes to advertising, one of the things that we're gonna have to do with the most notice would be, I was thinking like an HOA, like my Ashburn HOA. I go to like, they'll have like events listed and I love to go to those things. So I thought, but then you have to submit it like 2 months ahead of time for it to get published on time. So that's why I was thinking about it now. And that's why I know this is like the end of the summer project, but like we can't, it's got to happen now. Because if you don't want like nobody to come, and that would be okay. And then for people who, as you can see, I'm very serious about the points off related assignments. So if you feel that you need to make up some of the points, I'm gonna add like a bonus assignment today that's not like, if you don't do it, it's not like points off your total grade, but if you do it, then you get extra. And I did decide, not that I want everybody to be grossly over competitive, but I did decide that there will be a special prize and a special notation in the letter of recommendation for the person who ends this internship with the most points. And I do want you all to know that whenever somebody does something and I say you get 10 extra points, I do feel like I'm one of the Hogwarts professors and I'm like 10 points to Gryffindor. And I've temporarily thought like, oh, maybe we should have house and you guys can compete, but I'm not going to get into all that. All I'm going to do is whoever has the most points gets a special prize and a special notation in their letter at the end. So there's some incentive to gather up as many points as possible, which you can't do if you submit things late. Okay, and so we still have the project about the alternative medicine. So I had talked about the flotation therapy, but there's also—
Wait, do you want to maybe stop the recording? Because I know you want to put this on YouTube, so.
Well, You
I don't
know,
know.
maybe Miriam could splice it and make it look
Okay.
good. I don't know. She's supposed to edit it.
Okay.
Well, I'm gonna stop the whole thing soon in a minute anyway, but yeah, that was probably a good note, but she can cut this out. So the bonus things, oh, and then the alternative medicine is due today, I believe, and you know, like acupuncture, even massage, there's all sorts of things. I want to go get a massage and acupuncture right now. Okay, so any other questions before we end?
I had a quick question. I remember at our first meeting, there was something brought up about like banners for the Facebook, I think. Are we
Oh
still doing that?
yeah.
'Cause I think I signed up to like help out with that, so I can still do that.
Okay, so you can take a look at the Improved Life there are two Improved Life PLLC Facebooks, and you can take a look at both and see if you have any suggestions. And Shree, I put yours somewhere,
Okay.
but I don't think it was long enough to make like the banner. It was more because the banner has to be like a big long rectangle. But I did post it on Instagram, and I sent it to Miriam to post on the Improved Life PLC Instagram.
Okay.
But y'all, is everybody like and subscribe, smash that like button?
Also somebody brought up social media. I just put it in the notes, so I just wanted to come back to that point.
Oh yes. Okay, so I'm gonna make a video about this, and I don't know, maybe if Miriam can cut it correctly, this can be the video. So the thing about my professional social media accounts, like Improve Medical Cultures Instagram page, Improve Life's Instagram page, whenever a student or a patient follows me on my professional account, I typically don't follow back, but I don't want them to get upset like, oh, Dr. Waggel didn't follow me back, she doesn't think I'm cool, or like it. I don't want anybody to think that. If you want me to follow you back, just message me and I will. It's because, first of all, I don't want to know, like, I don't want to see my patients like kissy pictures with their boyfriends or whatever, you know. And like what you guys do, you know, if you're posting like night out at the club or whatever, like I will follow you back if you want me to, but I'm not gonna do it automatically, is what I'm saying. Because if you have a professional account, that's one thing, but it's like, this is my professional account. I have a personal account, which honestly, it's like, I guess you could follow that too, but it's not very professional. But don't be offended if I don't follow you back. It's because I don't want to invade your privacy. Because, you know, I know that Shree be like taking all those pictures with the wine bottle. No, I'm kidding. But I know what people post, and I don't want to be like creepy, like, oh, Dr. Waggel can see my picture with me and my boyfriend, you know? So it's just, I'm giving you guys privacy. But if you want me to follow back, message me and be like, gee, why can't I get a follow back, Dr. Waggel? Makes sense? Okay, good. I don't want anybody to be offended, but I don't want anybody's privacy to be violated. Okay, that's everything. And I'm going to put up a bonus assignment in the classroom, and then I will be checking everybody's assignments that are due today. And then any late assignments, 10 points off each day. And then I'll be so sad if they're late. Okay. Bye, everybody.
Bye, thank you.
Bye. Thank
You're
you.
welcome.
Bye, thank you.